Hello and welcome to the Teaching and Learning module. In this module, we'll talk about 3 different learning theories and we will see how they overlap. We're going to talk about adult learning theory, reflective practice, and constructivism. Rather than me just talking about these theories, I provided some additional videos and links for you. Also, there are 2 short, fun online activities that will require your participation. The goal of these activities is to help you to see why we each respond differently to the same situation, and this can be helpful as we attempt to understand our students and ourselves. So let's be clear, this module is not meant as an abstract discussion over learning theories. It's more about seeing how we can use these theories to support why we do what we do. We can better understand ourselves and our students to maximize student learning through the methods that we use, the assignments we require, as well as how we interact with our students. The underpinnings of this module are derived from the National League for Nursing Core Competencies, number 2, Facilitate Learner Development and Socialization. It states that nurse educators recognize their responsibility for helping students develop as nurses and integrate the values and behaviors expected of those who fulfill that role. I recommend that you review the specific task statements listed for the module. I've highlighted the statements that are most pertinent to clinical teaching. The task statements are the specific actions of this competency. As you work through the module, readings, videos, and activities, please have the following reflective questions in mind. What are your thoughts about how learning theories can be applied to clinical teaching? Discuss your learning preferences according to the VARK. What new insights have you gained after taking the DISC? What are your experiences using reflection in your own nursing practice? How will you use reflection in teaching? There are 2 articles and internet sources recommended for your reading in this module. Marcy writes about how she integrated the VARK and adult learning with physician assistant students. See if you agree with her thoughts. I highly recommend John's article, and I'll talk more about his article in just a few minutes. His article, unfortunately, is not freely available from the internet. Therefore, you'll need to obtain his article from the library. If you have difficulty finding the article, please let me know. The remaining suggested readings explain the online activities and learning theories. Let's review. Learning is acquiring new knowledge and is lifelong. Most importantly, it causes a change in either our mental processing or our emotional functioning. When we learn something, it changes our thoughts and actions. What we know is learning depends upon our motivation and is an individual matter of perceiving and processing information. The learner, not the teacher, is the single most important person in the educational process. During the learning process, the teacher can have a critical influence on learning through role modeling. The educator is vital in giving support, encouragement, and direction, as well as feedback, reinforcing learning and evaluating the learner's abilities. In a moment, I'll be discussing 3 of many learning theories. As I mentioned, learning theories give us a framework from which we can see how students learn and actually prefer to learn. The adult learning theory is based on the belief that adults and children learn differently. The assumptions of this model are that adults are self-directed and bring life experience to their learning. Additionally, adults are goal-oriented and must see the relevance of the information they are expected to learn, as well as its applicability. How often have you heard yourself saying, "So why do I need to know this?" I know that I've said that, mostly to myself. Most importantly, adults Respected in the educational relationship. Have you ever found yourself feeling like an instructor or someone else is talking down to you or treating you like a child? Well, I hope you're not feeling that way now. This module recommends preparing the learner as a first step, which is why it's so important to give clear explanations to students regarding the rotation as well as each clinical day. The great thing about the clinical experiences is that students can actually see the relevance of why they're there. It becomes very important to bridge the classroom with the clinical experience to strengthen the relationship between the didactic information to the actual clinical experience. Extending mutual respect is very important to the adult learner. This can be demonstrated through a supportive relationship, helping the student to see that you as the instructor is still a learner. Students often think that we know it all, and sometimes novice instructors think that they should know it all. We don't know it all. And it's okay to let students know that you don't necessarily know the answer to a question that they pose, because as a role model, you admit what you don't know. However, you say, let's look it up. Not necessarily you go look it up. You say, let's look it up, because now you're demonstrating appropriate professional behavior, which is, if you don't know something, you look it up. Now let me backtrack a little. It certainly is not wrong to ask a student to look up information on their own, and sometimes this can actually be the most appropriate response. Following this video, I have provided additional information about the adult learning theory and Dr. Malcolm Knowles. I encourage you to review it. Moving on to learning through reflection, I've recommended John's article titled Framing Learning Through Reflection with Carper's Fundamental Ways of Knowing. This 1995 article discusses reflective practice based on the work of Carper. I've included this learning method because it's most likely our primary method of learning each workday, and maybe every day of our lives. We know reflective practice as learning through the lived experience. According to Johns, reflective practice is our actual experience in caring for patients and then contrasting the experience with what we really wanted the experience to be. We know nursing practice through the act of reflection. As instructors, we can assist our students in learning or beginning the knowing or the art of nursing practice by requiring students to reflect upon their own practice. John's article is very insightful as to how we actually can learn from our reflection on patient care experiences. His article offers cueing questions that you might consider using when asking students to utilize reflection in their clinical journals. These questions are, what was I trying to achieve? How did I feel in a situation? How did my actions match with my beliefs? What knowledge did or should have informed me? How does this connect with previous experiences? Could I have handled this better in similar circumstances? Has this changed my way of knowing? These are some interesting questions, and sometimes this exercise is difficult for students. They don't often want to do it because when you attempt to answer these questions, you really need to reach deep inside and start thinking. However, through this work, we really do learn. What are your thoughts? Additional ideas for reflective journaling assignments can be found in Tanner's Guide for Reflection and Lassiter's Rubric for Clinical Judgment. Lassiter's rubric can help to more objectively judge a student's reflective thinking without judging the student's actual writing. When a student writes in their journal, it needs to be judged only on how they're thinking, not necessarily their technical skills of writing. Of course, an exception to this would be if you are using the journal as a writing assignment. These tools and articles can be found in the Clinical Toolbox, and I talk more about them there. Reading these articles will help to give you a sense of the usefulness of reflective journaling. In constructivism, learning occurs when the learner can make connections between new material or experiences and previously learned material. This type of learning is said to promote collaboration. Students participate in their own learning. This theory empowers students to learn through their own guided experiences and then reflect upon these experiences. So you can see how this model overlaps with reflective practice, and it complements reflective practice. It's important to remember that each of our students comes to the educational process already knowing something, and I'm not trying to oversimplify this or state the obvious. In my experience, though, at times I found students on both ends of the spectrum of this sense of knowing. Some a little overconfident and some a little underconfident. I think it's important for us to remember this so that we can reinforce the fact that students should be encouraged to build upon what they already know. We do not expect them to throw everything out and start over again when they begin nursing. I've seen students that do not trust what they already know. I've attached a handout to the module from the 2014 OADN conference where the speakers talked about this model. The handout is called Deconstructing Constructivism, and it includes some possible learning activities that you could consider using with your students so they can build upon what they already know. Suggestions include case studies, which you could use in a post-conference. Students can be paired for an activity and then they can share what they have learned. And then simulation is definitely an example of using constructivism. Constructivism could be applied to you right now. You're building upon your own past experiences in nursing, as an RN, as a student, and perhaps as a preceptor. In the next short video of the module, John Abbott further defines constructivism.